Québec dit, c'est que votre proposition n'est pas suffisante, le 6 que vous promettez. Je me demandais, est-ce que vous êtes prêt à augmenter la mise, à en donner davantage?
Avec une relance économique et avec croissance économique, on va avoir plus de 6 J'ai dit que notre chiffre est un minimum maintenant, mais c'est prévisible, stable et sans condition. Et je vais toujours respecter les champs des compétences pour toutes les provinces, incluant le Québec. J'ai beaucoup de respect pour le leadership de M. Legault pendant la pandémie et je vais être là comme un partenaire dans le futur.
Vous connaissez les demandes des provinces, vous savez combien elles veulent en transfert, le montant est beaucoup plus élevé que ce que vous promettez. Est-ce qu'elles vont l'avoir avec ces augmentations que vous proposez?
Dans notre plan pour le rétablissement du Canada, j'ai un plan clair sur la santé et je vais augmenter avec 6 minimum et peut-être avec une relance économique forte, on va augmenter plus de 6 En plus, je vais donner l'argent pour la santé mentale des Canadiens avec le gouvernement, mais aussi avec les organisations à but non lucratif sur le terrain. On va travailler avec les entreprises sur les programmes pour leurs employés et je vais donner 325 millions de dollars pour les programmes de traitement pour les toxicomanes. Donc, je vais être là comme un partenaire pour le Québec et pour toutes les provinces.
Next question.
Hi, Mr. O'Toole. Good morning. Stephanie Taylor with the Canadian Press. I want to ask about what your platform says about the TRC calls to action. You've committed to implement 71 to 76, but there are many more directed at the federal government around child welfare legislation, around healthcare. So can you be clear, do you commit to implement all of the TRC calls to action directed at the federal government or just those ones, 71 to 76?
We're going to make progress on the TRC calls to action, because they're very important and they should be beyond politics. And in fact, with respect to child welfare, when I was in Cowessess, I spoke to Chief Delorme about his First Nation being the first to advance under the new model for child welfare. I want to see more partnerships like this. My first question as Leader of the Opposition when I stood in the House of Commons was on reconciliation. It's very important to our party and to me personally, and I would like to see concrete action and partnerships with Indigenous leaders, not the empty promises made by Mr. Trudeau that he never follows up on. So the TRC calls with respect to missing children are very important as we deal with the trauma of Kamloops, Cowessess, and other communities with former residential school sites. But all the calls to action are important, and we will have an action plan to tackle them.
What do you mean by progress, and when would you be showing that specific action plan if you plan to? And to be clear, is that a yes? You do plan to implement all of the calls to action directed at the federal government?
Mr. Trudeau, when he first became Prime Minister, said he was moving immediately on all 94, and then provided no roadmap, no plan, no partnerships, and really has tackled very few. I want to partner with Indigenous leaders, with First Nations, to come up with an action plan to deliver and to set priorities based on their need. Yesterday, I announced $1 billion over 5 years to tackle mental health, to tackle addiction, some of which comes from intergenerational trauma from the horrific chapter of residential schools. Reconciliation at its core is about reestablishing trust with the federal government. I will do that by partnering with Indigenous leaders. Mr. Trudeau erodes trust when he makes promises with no plan to ever achieve them. I will be about action and partnerships.
Next question.
Hi, Mr. O'Toole. Hannah Thibodeau from CBC National News. I want to clarify something. Would you further prevent the use of privatized healthcare in Canada's system?
As I've said, I 100% support our public and universal system. I always have, and all Canadians have been, confident in the fact that it's been there for us with this pandemic. So in Canada's recovery plan, in our platform, we're securing $60 billion of new funding in a predictable way to the provinces so that they can make the decisions on how best to rebuild and build up their capacity following the pandemic. All provinces are going to be going through how they need to improve, how they need to address long-term care. I think Ottawa needs to be a partner, not a paternalistic Ottawa knows best player. We want to partner with provinces, and Canada's recovery plan is completely transparent on how we will fund our public system at a minimum of a 6% increase per year, and how we will go further in terms of mental health supports and addiction. On doit travailler en étroite collaboration avec les provinces sur notre système de santé. Je vais augmenter les transferts dans une manière stable, prévisible et sans condition, avec un autre 60 milliards de dollars pour les provinces. Et je vais toujours respecter les provinces et leurs priorités pour leur système, incluant les CHSLD, les résidences pour aînés. On doit travailler ensemble sur les défis devant nous après la pandémie. C'est une approche de partenariat, pas de paternalisme de M. Trudeau.
Respectfully, sir, you didn't answer my question, so I'll ask it this way. What sort of privatization would you support in Canada's healthcare system?
I respect the provinces is their jurisdiction for healthcare. The federal government needs to do a lot better job on Indigenous healthcare, which is a federal direct responsibility, on veteran and Canadian Armed Forces healthcare. That's why my first question as opposition leader was on Indigenous healthcare. It's why yesterday I announced $1 billion over five years to help with mental health and addiction supports for First Nation communities. Our public and universal health system is a pillar of our social safety net as Canadians. I not only support it, I will defend it and build it up with an additional $60 billion is our commitment in Canada's recovery plan.
Next question.
Hi, sir. Kevin Gallagher with CTV National News. I just think I still want some clarity on the public-private health care questions here. So if you're saying that you would support or you would allow provinces to make their own decisions because it's their jurisdiction, so if Alberta or Ontario or Quebec decides that they'd like to expand privatization of health care, you wouldn't stop it?
I support our public and universal system. Full stop. It's critical for our country, and it's very important for us to build it up after the pandemic. That's why in Canada's recovery plan, we've committed an additional $60 billion in total to the provinces. We will respect their jurisdiction by not setting conditions and tying it to things that Ottawa decides is best, rather than the needs being assessed on the ground. And as I've said, we're also going to show leadership on mental health, on addiction, and we've been completely transparent. On day 2 of our campaign, we've put out our platform, and I'm talking about it every day. What is Mr. Trudeau talking about? Division, misleading people, importing American-style media manipulation to our campaign within the first 10 days of a campaign he called in the middle of a 4th wave with forest fires in British Columbia and unfinished business in Afghanistan for Canada. It's been, quite frankly, very disappointing to see Mr. Trudeau's misleading and divisive campaign so far. I think it's another sign that Canadians want change. They want a team that's ethical, that's in it for all Canadians, and someone with a plan. We have the plan.
I'll stay with privatization here, but I want to focus specifically on long-term care facilities. You mentioned the pandemic and the importance of the universal health care system during what Canadians went through. We saw what happened in long-term care facilities. The NDP are calling for public long-term care. They say privatization, and also there's academic studies that show privatization in long-term care has led to poor outcomes and deadly outcomes in some cases for long-term care facilities. What is your position on the privatization of long-term care facilities?
Well, the sad situation, the tragic situation in long-term care at the first wave of the pandemic was really the most heartbreaking part of the early stage of COVID-19. And in my own region of Durham, one of the first homes hit was a publicly owned long-term care facility. We weren't prepared. And Mr. Trudeau gave away PPE, was slow on obtaining vaccines and rapid tests. So what we need to do is make sure we're prepared. And Canada's recovery plan, our fourth pillar, is making sure we're never again unprepared, building up capacity, making sure our healthcare system, vaccines, critical medicines, PPE are supplied. So we will be a partner with provinces as they prepare their long-term care systems to better respond to a health crisis like COVID-19. We will be a federal partner that will be there for the masks, the PPE, the vaccine supply, and our $60 billion of commitment of additional funds for our public health system. That will help provinces address needs in long-term care and in the hospital setting as well.
Next.
On doit travailler sur les défis après la pandémie pour les résidences pour les aînés, les CHSLD au Québec et notre système de santé. C'est pourquoi je vais augmenter les transferts avec un autre 60 milliards de dollars et je vais respecter les décisions par les provinces sur leur système. Et on doit aussi être plus prêt dans le futur pour les pandémies, pour les crises sanitaires. C'est pourquoi dans notre plan pour le rétablissement du Canada, notre quatrième pilier, c'est sur la préparation. On doit être plus autosuffisant avec les vaccins, avec l'équipement médical. C'est le temps pour un gouvernement fédéral qui va agir dans nos intérêts et qui va être un partenaire pour les provinces.
Next question.
Mr. O'Toole, Michael Couture from Global National. I wanted to ask you about your announcement today. And how does adopting a suite of union-friendly policies help you in fighting for voters who may normally lean towards the NDP? And also, how might it blunt the spending powers of unions who, in the past, have historically campaigned against the Conservatives?
Working Canadians and their families have one party to choose in the next election. If they want work, steady work, if they want a seat at the table, if they want the economic recovery after COVID to include them and their families and their communities. Only the Conservatives are offering a seat at the table for large federal enterprises, the banks, the telecommunications companies. Workers will get a seat at the table. And all of the other parties don't want to see an economic recovery in all sectors. They want to pick or choose who gets a job again after COVID. We need an economic recovery that includes all Canadians. And so we have many provisions here to make sure that workers know the Conservatives will fight for them, not just to give them a seat at the table where decisions are made. We're going to make sure that they're part of decisions on rolling out infrastructure, standing up for more fair trade rules, making sure that we support manufacturing, our resource sector. I have the same goal as many union organizations. Jobs for their members and strong economic futures for their families. Je vais travailler avec les syndicats pour leurs membres qui ont besoin d'un plan pour une relance économique dans tous les secteurs de notre économie et dans toutes les régions de notre pays. Nous sommes le seul parti là pour les travailleurs et leurs familles. Les autres préfèrent des secteurs spécifiques, mais pas une relance économique pour tout le monde. On a un plan pour le rétablissement du Canada, une reprise économique, et les travailleurs méritent une voix forte, méritent une chaise à la table des décisions. Et aujourd'hui, je viens d'annoncer un plan pour un siège à la table avec le conseil d'administration, avec les grandes entreprises à charte fédérale.
Just as a follow-up, your party's often said the Conservatives are the party of free trade and free markets, especially when it comes to infrastructure, and especially in dealing with the Americans. So I wanted to know why, in what you're proposing today, are you adopting this principle of Buy Canadian and advocating for this protectionist procurement strategy?
With the Conservative government, you're going to see a lot more made in Canada. And you're going to see an approach where we stand up to countries that abuse international trade rules, like Communist China. We're very proud of what we make here in Canada. It's the best in the world because we have the best workers in the world. And I support free trade, but free and fair trade amongst free countries and not countries that game the international system at the expense of our workers and our values. Countries that are committing genocides and not following trade rules should not be benefiting from the global trade system. And countries that have free and fair trade and access for our goods and materials and services will have the same here. So we need to rebuild our relationship with the Americans, for example, which is, I think, at its historic low under Mr. Trudeau, with Buy American, with Line 5, with Keystone XL, with bad results for agriculture, for steel, aluminum. I will stand up for our workers, and I will also make sure that we work with our democratic allies to rebalance global trade.
This will be the last question. Ce sera la dernière question.
Good morning, Mr. O'Toole. It's Chris Selly from the National Post. Yesterday in Vancouver, you said that you would not, a government led by you would not stand in the way of new safe injection sites. I wonder if that same non-intervention policy would apply to programs offering pharmaceutical-grade opiates to people struggling with addiction.
As I said yesterday, we support harm reduction initiatives. All Canadians want to see harm reduced, people help. That's at the focus of our addiction strategy. We also want to see treatment and wellness. And I met the founder of Last Door yesterday, found him inspiring, someone that overcame addiction 38 years ago, and since then has helped thousands of people on a path to recovery. So what we want to ensure is that we see compassion with our criminal justice system, that we respect harm reduction and other initiatives that help people in the short term, but also offer treatment options for people in the long term so that they can be productive parents, get back to work and live productive lives. That's what I think all Canadians want to see. So we're committing to 1,000 treatment beds, 50 community centers, and because of the unique needs and because of our commitment to reconciliation, we will have $1 billion over 5 years for culturally appropriate treatment options in partnership with Indigenous communities. It's the right thing to do.
This has not traditionally been your party's position. I imagine there are many within the party who sort of feel that supporting things like safe injection sites, or not standing in the way at least, is a bit of an abandonment of sort of a law and order agenda. I wonder what you would say to them.
I disagree with them. Conservatives have always been compassionate. If you look at most Rotary clubs or Lions clubs or church organizations helping people, the early shelters opened in most cities, most food banks opened by groups of volunteers, faith organizations. Conservatives have a compassion that motivates us. And I think when it comes to law and order, our tougher approach on the criminal justice system should be preserved for people that are harming others, the dealers, the people exploiting people with addiction. And let's have compassion for the people that are suffering from addiction. And so we've gotten a great response from our announcement yesterday, and I actually think it's very much in line with the sort of big hearts that Conservatives have to make sure that everyone is well. And following COVID, we've seen an increase in the opioid epidemic. We've seen an increase in domestic violence and many, many things that we need to tackle. And Canada's recovery plan has several substantive measures that I think will help our communities recover as much as our economy.
It will be all for today. Ce sera tout pour aujourd'hui. Merci. Thank you.
Merci beaucoup. Thank you very much.